Hi everyone, I am Anushka. Welcome back to my channel, and in this video we are going to talk about some very essential tips for writing your second year MBBS university paper. And I want to warn you that this video is not about how you should study in your second year, but about how you can write your paper in a better manner to make the most out of your knowledge, and how can you make it more presentable. Okay, so why should you listen to me? Because I have done a lot of things in my second year, and yet I was able to score pretty good marks, which is above distinction, 77.7%, and which is I'm quite happy for that. And I know I could do this because I had cracked the system, and that's what I think I can tell you in this video. So stick till the end if you want to know some pattern that I have noticed in second year papers. And I'm gonna break this video into basically subject-wise management, then some time management tips. Let's get started. So let's start with the subject pharmacology, and I think this is a subject of a lot of drugs to remember, a lot of memory based, but all we do is just kind of ram all the classifications of KDT, even though we don't really understand them. Does this happen to you? Does this sound familiar to what you are doing? So what I would suggest is, I did not do this. What I did was, I liked KDT's classifications, but I did not use all of them. I used some GRG's classification because they were based on mechanism of action. And if you notice, most questions from university examinations are usually asked on the classification of the drugs, and they don't necessarily mention which classification they want, like based on what they want to classify, like chemical nature or mechanism of action. But what I think is the best is the mechanism of action. Not necessary, very big thing, that not necessary to follow all the KDT's classification. So because I remember that I did not like anti-epileptics classification based on the chemical nature, so I classified them on sodium channel blockers, potassium channel openers, or calcium channel blockers. SCI classified them, so you can do that too. And also I want to let you know that if they ask you the mechanism of action, then make sure to make a diagram that clearly states how does that work. If you want to write the mechanism of action of a drug, suppose now CNS is coming into my mind, so I would say about anti-epileptics, then how they depress the neuron. Draw a diagram showing how there is efflux of ions which make it more negative cell and then depresses it, hyperpolarizes it. Draw it in a schematic manner. I'm not asking you to draw it ekdam perfectly, like beautiful diagrams, colorful diagrams. No, diagrams that catches the attention of the examiner. Okay, so that's it for Pharmac. I think I made a book also. I will show you that one sec. Also about the side effects, like everyone says that write side effects which are very specific. I also highly recommend it, but if you know only 2 or 3 side effects, then write those first which are very specific to that class of group, and then move on to the side effects that are very general, like gastritis and all of that. And please don't ever write nausea and vomiting for antiemetics, please. So I made a book of myself about like the ones that I like. So in that I made classifications which worked for me, and also a bit of sticky notes. So I wrote the classifications that worked for me. I did not rely on the classifications that were already made. I made some from GRG, some from KDT, mostly from GRG, and I really think that this made me remember, and I assure you that this will really help in your grand vivas. It is like all you got to revise in your grand vivas, because when they ask, you should be able to track which drug it was, hormones, which SERM kya tha, aisa sab yaad aa jata hai if you make this book of yours. And I am really like very grateful to make this. I hope you can see it, how it has been. So moving on from Pharmac to Pathology, one of the subjects that is important and very important concept wise to know about the pathophysiology of the disease, which is the thing that they mostly ask. So if they ask you to write a short note about any disease, then I want you to write it in 4 to 5 categories. which is the first thing, the etiology, how does that happen, then the pathophysiology, which is the most important part of pathology, and like what is the normal and how it varies from the normal, to write all of that in a flowchart manner, because flowcharts and diagrams will help you very much, because you are going to save time instead of writing in paragraphs. Also, secondly, I think that flowcharts help the examiner also to know that you know it. Yeah, so it makes it easier for both of you. After pathophysiology, write about the clinical features, what you see in the patient, how patient will present to you. Then complications and a bit of treatment like supportive care or whatever you think can be the treatment based on your pharmac knowledge. You can also add that, because that gives impression that you are thorough not only with patho but pharmac also, because you'll already be done with pharmac paper, right? I'm not saying ki har question mein likho, but if you know, if you can remember, recall, then please write it. About the H&E diagram, the histopath diagram, if they don't ask, I would highly suggest that you can still draw it. There is no harm in drawing that. Just make it quick in the cases that they haven't asked, and in cases of they've asked, like draw it, label it अच्छे से एकदम. You don't have to make it very beautiful. You have to make it understandable. That's the point, because you have limited time. So for patho also, I made a quick revision book in which I'll show you. I drew the diagrams, like this is chronic peptic ulcer, this is chronic peptic ulcer, then this is renal cell carcinoma, and also I wrote some features about it, so that when I revise it, it also helped me, like, see if you want to see if you can see. So it also helped me revise very much. It helped me in my practical papers. So some I did not write because I did not get time, but it was really helpful for me to revise how should I draw the diagrams of it, because I drew this, and it also helped me revise while I had my practical examinations, and this video is not about that, so I will make a video on that also if you really want it. Comment down below if you want it, like how you can ace your vivas and your practical examinations. So I really think that this really helped me. You can also make your own. If you don't have that much time, then you can look for resources that help you with these diagrams, the diagrams that are drawable, not the diagrams which are very you should draw the diagrams that are drawable. And please don't forget the mention, like very important cells like Anushka cells or Langerhans cells. Please don't confuse Langerhans cells with Langerhans, like common mistakes, all of this. Also, if you think that a short note has come and you don't know the answer about it, then I would suggest ki write it in paragraph form, and write more, explain it in ekdam basic language and more, because when you know that you don't know the answer of this question but you can expand a little, then that time it's not a good idea to draw flowcharts, because you don't have a clear concept about it. If you have, well and good, draw flowcharts. If you don't, then write in paragraphs, because that will not fetch you more marks, but it will be better and you won't be caught in your loopholes of not knowing the answer. So in patho, if they ask you like a difference between transudate and exudate, for example, and that question is for 7 marks, then I would like to say you that at least write 10 to 11 points. Now you will be like, how can I write 10 to 11 points when I just can remember 7 points? I'll tell you. Very important point, compare it in a table with a criteria column as well, wherein you know that this is about definition of this and this, in which conditions transudate there is transudate, there is exudate, like also what is the like physical appearance, components. Instead of components, how you can expand your points is like you can write protein content. In transudate there is less protein, whereas in exudate there are more proteins. Cells, directly components mein writing all the points, you can segregate the points, expand the points. That is what I am asking you to do. So now talking about microbio, which is the most asked subject. So in this I want to talk about, like, most things that they ask you is about laboratory diagnosis, and in that I want you to be more specific. Like if you know the answer, suppose Klebsiella, then you know that Mekong agar is used to help you differentiate it from other other gram negative, then also gram staining. You have to write the laboratory diagnosis from the most specific to that particular organism to the least specific. And also don't forget to add like PCR, then backtech, Vitek, all of that stuff that is given at the end of almost every bacteria, or different for viruses like culture medias, then different for virology, fungus, all KOH mount and all of that. All I want to tell you is that make your laboratory diagnosis divided into specific ways. Genetic technologies, molecular technologies, then how can you grow it in culture media, then blood culture, agar, all of that. Divide it and make it from most specific to least specific ones. Also here, don't forget to make diagrams, because it will help you boost your answer, which will grab the attention of the examiner. Kyunki, see, if you know Klebsiella, you know Mekong ki agar. To identify its Klebsiella, it turns pink. Then you know that, then also just take color pencils, draw a pink color circle and some organism. That will let the examiner know that you know it. And that's the aim of the whole university examination, like letting the examiner know that you know the answer. It's not about examiner trying to find out what all you know. That happens in MCQ. This is mostly theory, right? So now let's move on to the time management techniques. And in time management, I would like to say that I know about MUHs, where the paper pattern is about 20 MCQs for 30 minutes. Then the remaining 2.5 hours, which is 150 minutes for 2 long answer, which are not optional this year. Like there is no option for it. You have to attempt it for 12 marks, and 8 short answers, out of it 10 out of which 2 you can exclude of your choice, and solve the rest 8 in, which is about 7 marks, right? So my method was not in the way the paper has been asked. I used to jumble the order most of the times, and I used to start with LAQ, because if LAQs are done, I used to feel relieved, and then I can write as much as time allows me to write for SAQs. So I used to do that. LAQs first always, क्योंकि LAQ में कोई compromise नहीं होना चाहिए. LAQ should be written as per I know, but there should be a time limit, नहीं तो लिखते ही जाएंगे. So LAQ I used to give around 20 minutes per LAQ, which makes about 40 minutes. So not more than 20 minutes, and you have to write, starting say write it with a good pace. Write all that you know, and less of thinking, more of writing is what was my strategy. So उसके बाद for short answers also you can do that. Draw diagrams. If you think that you can write more for this answer but you don't have the time right now, then leave some space and move on to the next question. So that's how I did it. So I allocated, as I said, 20 minutes for LAQ, and then about 12.5 minutes per SAQ. So I did not keep a timer like 12.5, but I made like 2 questions in about 25 minutes. And that's how at the end of the whole paper writing, I used to get 10 minutes as a buffer time. Check whether I've written each and every question. My biggest advice would be solve each and every question, even though you don't know a lot about it. Even if you know a little bit, or at least nothing, you can write something about what the question asks you. Kuch bhi likho. Because if you don't write anything, it's completely for sure you're going to get 0. But I think you should write something. It'll fetch you some marks. Better than nothing. Lastly, the thing that I wanted to mention at the end of the video is here now, which I want to say that don't worry, because every year there is one subject which turns out to be odd, which is not out of your previous year questions, which is something you did not expect. If it is going to be tough for everybody, so don't worry, write as much as you know, and don't get panic in that state. Learn to keep your calm. That is what I learned during my examinations. In our seniors, the subject that was odd was micro. During our time, patho was odd, and I think the next subject left is pharmac, but I'm not commenting anything. So all the best for your paper, for your examination, and do let me know whether these tips helped you, and if you benefit at least a little bit from what I said, because I think if I know something from my experience, I can always share that with you guys, and it can help you as well. So please like, share and subscribe to my channel. Bye, see you in the next video.